Codes.
COVID. We're going to whip through COVID.
Yeah.
Well, 1,807 deaths last week, and nobody's talking about it. Nada, nothing, nobody.
But the forecast is looking up.
Oh my God. Relative to the full pandemic, transmission remains higher today than during about 86% of the pandemic. At the rate of 1.2 million daily infections, that is translating to over 60,000 long COVID cases, 1 in 38 actively infectious.
What's should be alarming about that number is the number itself. Like we're like 4 years into the pandemic, and that's where we're at. This is everyone should unmask and just trust the vax moment. But more so than that, if you follow the curves, at this time of the year, we're normally coming out and we're on a downward cycle, and we're headed back up right now still. And we're at a higher point now than we were in every other prior year for exposure.
Right. Yeah. The valleys are higher. The valleys just keep getting higher. So there's peaks, and then when it goes down, it actually is not going down that far. There was a really good article in the World Socialist website on, I think a lot of us probably follow Greg Travis, who's a data analyst. And he was talking about excess deaths from disease in children since the pandemic are over 2,400. And children under 18 are the only demographic that has seen a steady rise in excess death in all 4 pandemic years, which I know we talked about this before, but when they talk about life expectancy rates going down, what that means is younger people are dying. That's how those averages work.
Right.
So we have more younger people dying, which is bringing down our overall life expectancy in this country.
Which makes it, in my opinion, especially evil when you have the COVID denialists still pushing that kids are not affected by COVID.
Yeah.
Which is, it's just like the Hamas stuff. It's like, it's the lie that started that they can repeat. Just like the mass study is the lie that got out there that they can repeat.
Right.
They fall back on all this stuff and then they're like, well, it's complicated. We're stuck with it.
Yeah.
If it was really a threat, our leaders would jump in and save us.
Yeah. I do think a lot of people operate under that fallacy, unfortunately.
Oh, 100%. Like I think, 100 isn't
climate
accurate,
change.
I think like at least half the people that are minimizing COVID think if it was really, really a risk to most people, the government would do something about it. They'd put masks back, or they think, well, masks don't work if the government doesn't put it back, which is why we have people, I don't know, I shared it this week, but the hospital story.
Oh my God, horrible.
About, a woman in an ER she's immunocompromised, extremely high risk for COVID, goes in there, brings 50 masks, tells them in advance, please wear the mask, tries to give them out. So they label her in the ER as a problematic.
Mental disorder, or like having psychiatric issues.
Yeah. So eventually, she hits a point where like to even get seen, and she's been in the ER for like 36 hours or something. She has to clear the psych ward to get to treatment. And all she did, per the ER nurse that was on her side in this situation, who was there, but her own colleagues don't mask, and her own colleagues were the ones doing this to her. All she did was want people to mask, like nothing else.
With an airborne virus that's a biohazard level 3. But as we know, that is now spreading to all sorts of communicable diseases. We now have COVID in schools in Florida, and the Florida Surgeon General is telling unvaccinated kids that they can come to school.
Oh, you meant measles.
Measles. Why? What did I say?
You said COVID, but yeah.
Yeah, I meant measles. Sorry. Measles, because, not only are people not vaccinating their kids for regular childhood diseases that had almost been eradicated, because of this anti-vax nonsense that has been, perpetrated on this country by the Koch brothers and Brownstone Institute. But it's lowering everyone's immunity. So if, it works, these vaccines work because of herd immunity. The more people who get the vaccine, it helps protect everybody. They're not 100% foolproof.
And I mean, the important part of it is there's so much herd immunity, which is this thing that these people sold us on why we shouldn't even have to wear masks anymore, whatever, it's going to solve the problem. It protects the immunocompromised because they're not around it as much. So the likelihood of getting it, because so many other people are vaccinated, protects them. But now we've got measles. And when it comes to measles resurging, what country was it with RFK? RFK and measles. God damn it, I wish I remember the country, but he basically, because he traveled around the world and chased every anti-vaccine thing he could, and convinced that, a lot of people out there that in whatever country it is, someone in the chat, help me out here. But because of that, they had a measles outbreak that killed tons of kids in the country
because they channeled it back to RFK Jr.
To RFK because they had an outbreak, and he went over there and convinced everybody. He got a lot of the public to believe that American Samoa. It was Samoa.
Okay.
He got a lot of people out there to believe that, he turned them on to anti-vax stuff because he helicoptered in like, oh, here you go. It's because of the vaccines. That's why you guys are having this outbreak. And then, of course, they have a rampant problem.
Oh, that's horrible.
So no, fuck RFK forever. People who are like, well, he's anti-establishment. Add into that his
border policies,
pro-Israel stuff. Thankfully, he had his pro-Israel stance, because that, to me, sacked his potential chances of somehow getting it
from people on the left. Yeah.
Right.
But, nobody should think it's just happening in Florida. It is also in Ohio. If you were at the busy Kroger store between, Kroger Marketplace at 885 Union Boulevard between 12:45 and 4 p.m., you were exposed to measles on February 13th. I mean, this is just insanity. And as Daniel in the chat said, we've got TB back. I mean, at least with TB, as we talked about last week, there are still protocols in place that are pretty drastic. The isolation, the having to be on like video with the doctor or pharmacist as you're taking the pill, like all of those sorts of things. COVID, which is the number one communicable disease, the contagious disease killer in the world, is COVID.
Right.
That we're just raw dogging there with, but with TB, which is it's the second one, that one we still have the protocols in place.
And here we are in the U.S. with the highest transmission rates. We took over this week. It dipped. We've had it before, but now we're back to being number one. We're back to exceptionalism right here in the U.S. Highest transmission rates, and people are just trusting the government on this right now. And the left is just ceding this issue to the most radical right-wing fuckers on the world. And they're just, our government is owned by the people that want you to work and die and do whatever you can to make their boss and their stocks go up. And all the left is just like, yeah, that's good.
Well, the crazy thing is the Florida Surgeon General who put that out, who said you can go back to school, says we know it's a financial burden for parents to have to stay home with kids. Well, there's a solution to that. I mean, there's solutions to this. A lot of people who are ostensibly on the left who talk about lockdowns and how they were so damaging for the working class, and they were, what you need to talk about is not that we shouldn't have had lockdowns to protect us, because who knows how many more people would have died if we hadn't had those, couple of weeks where we weren't allowed to go to bars. But what you fight for is a government that actually provides social benefits for its people the way they did in other countries, which is why, as you're saying, we have the worst transmission rate. We have the worst excess death rate, the worst COVID deaths. Other countries paid their people to stay home. And we didn't do that. So yeah, the working class, Black and brown communities were affected at much higher rates. They continue
Right.
to be, but the answer to that isn't just like, well, throw up your hands and live your best life. It's let's get that government working for us. Healthcare, paid sick leave.
And look, let's get clean filtration systems in place and start recognizing if we are going to just live with this thing forever, let's make it a little bit safer for everyone with clean air and filtration in restaurants and bars and schools and
Yeah.
workplaces. You know, that's not something it's not impossible to do that. It's not that expensive to do that. You can incentivize businesses to do it with some tax breaks, and there's all kinds of ways to do this. But because the government is so interested in perpetuating this myth that we're post-COVID somehow, they don't want any of this liability to fall back on them, and they need to not spend $1 on it because it'll hurt Biden's reelection campaign. And Trump also is a minimizer, so he can't go there. You know, we're never getting out of this. You know, at this point.
This was,
so we
by
have
the way,
to raise hell and somehow get attention and drop shit on Nancy Pelosi's doorstep. And you know, we need more of that. We need doctors and nurses and the people in the industry screaming louder than they are. I mean, they're screaming, they're not getting attention, but somehow something has to break within the medical field itself to.
Well, it's kind of crazy to me how many people in the medical field refuse to mask or minimize COVID. So, I mean, I know obviously a lot of the doctors, epidemiologists, scientists that we all follow are not COVID minimizers, but they are up against people in their environment who absolutely, you know, I guess it's a lot like the initial resistance to washing hands before doing surgery or coming into a room. But it just seems so wildly unscientific when we have the data. Like that was a new thought. Oh, hey, we need to wash our hands so we don't spread infections around. Masks have been around for over a century.
Right.
They know how to stop an airborne disease.
For them to know that they work and then be so susceptible to propaganda, basically, that they, and peer pressure. It's a mix of both. Yeah. It's their bosses and their coworkers, you know, they don't want to stand out in that field. They don't want to ruffle the feathers. They need to take home their paycheck to pay for their expensive house as well. It's just that part of it, you know, it has to change, and it's not going to change by just getting out in the street and protesting, even because even with Israel, you know, the protests alone aren't doing jack shit. I mean, it's a step.
They aren't. You're right. But I know it's not moving the needle at all.
It's not moving the needle, and to move the needle in the U.S., we need all those politicians to know, A, they're never going to win election again if they don't change their views.
They have to cut off the money
they're not safe
supply.
in public. They're not safe in public. I mean, you know, take that however you want to make it, but
I mean, unfortunately, you know, the people in power are leaving no other options. We don't have a democracy because the people in power aren't listening to their constituents. We know people want healthcare, they want free public college, they want a living wage, they want a ceasefire, they want, you know, none of that is listened to. They don't listen to us with peaceful protests. You know, you're leaving very few options for people to get what they need and deserve.
And we're still getting so this is the newest. I saw this recently. We're getting a lot of propaganda still, you know. So the people that want you to believe COVID isn't a real thing are saying now, oh, even the Red Cross is on board with saying, you know, oh, if you got the vax, you can't give blood. They're not saying that. You know, that's nonsense. What they're saying is, if you got a vaccine within a certain number of days, you need to wait a little bit before giving blood. Just like with a lot of things. Did you have you know, I don't give blood. Sorry.
Oh, wow.
Yeah. I know, you know, you have to, you know, if you had risky sex or something, if you use a needle or something, they're going to make you wait a while. It's not any different. This didn't.
Right.
They're not saying, oh, if you had the vax, your DNA has changed and you can't give blood.
Yeah, I need to look it up because like within the last year, somebody found where they asked if you've had COVID. you can't give blood, which is going to be really interesting, knowing that like 88% of our country has had COVID. I mean, when they talk about,
I'm
when
going to
we
start
talk
giving
about,
blood if it's like $1,000 a pop, because
right, exactly.
I could be in like, this could be some precious blood over here.
There
Not to
you
get
go.
racist.
Yeah, just
I didn't
stay
mean it like
isolated
that.
in your house. You're going to have a whole cottage industry of just blood and plasma and everything.
Just slide the $1,000 under the door. I slide out the plasma.
Yeah, I mean, the healthcare system is already borderline collapsing in so many nations, especially ours. But when it becomes clear that blood is possibly not able to be used by people who have had COVID, that's going to be a real quagmire
And
for us.
that is a very, very fucking real possibility.
Yeah.